Well, the wheeling and dealing still in full swing on Capitol Hill as President Trump and House Speaker Paul Ryan are making their last-ditch efforts to get their Obamacare replacement passed. Moments ago, Press Secretary Sean Spicer saying progress is still being made as the president plans to meet with yet another group this afternoon at the White House, this time the Tuesday group. Spicer says the president expects a vote tonight and was adamant that there is no plan B.
It's going to pass. So that's it.
Well, it was short and sweet. That's it. No plan B. But are there enough votes to get this thing passed? Well, I'm joined now by a Republican congressman from Alabama, Bradley Byrne. Congressman, thank you so much. Let me get your perspective. Where do we stand right now as far as you're concerned?
We've got the bill. There's only one bill, by the way. There's not another bill. They're talking about one potential change to it from the manager's amendment we got the other night. And it's either that or nothing. And so it's time to put this bill, with whatever changes they have worked out at this point, it's time to put it up for a vote. I think the votes are there. I think it will pass. But as long as we prolong all this with all this talking, the odds of it passing can actually start going down. So my advice to the leadership has been and continues to be, put this bill up to a vote tonight.
Yeah, but you're trying to appease those more to the conservative side, and as you do that, and as they win concessions, you start to scare off and alienate the moderates in the party. It's a very difficult line to draw, and if you're not sure you don't have the votes, why would you go forward with the process?
Because there are people in the so-called no group, and I've talked to some of them individually, who don't want to be a part of an effort to take down the only bill that repeals and replaces Obamacare. Put it up for a vote, they'll vote for it. But having us all just dangle out here like they've been dangling us out here the last day or so, I actually think that's hurting the chances of the bill. And I've told the leadership that. They need to put this bill up for a vote, and I believe it will pass. If it doesn't pass now, it wasn't going to pass. And we need to admit that.
Yeah, but how frustrating is it after, what, this is the 7-year anniversary of Obamacare coming into law? Is this what we've been able to come up with as far as the Republican Party is concerned? 7 years later, and here we are with some members saying we should scratch it all and begin again.
Well, those members are wrong, because an awful lot of work has been done to this bill. It's a good bill. It's such a good bill from our conservative perspective that from Nancy Pelosi all the way down through everybody in the Democrats, they're absolutely against it. So the people on the Republican side that are talking against this bill are joining forces with Nancy Pelosi. Let's make clear what's going on here. There's one choice: to vote with the president to repeal and replace Obamacare, or to vote against the president and vote not to repeal and replace Obamacare. Clear choice to me.
Well, but Congressman, we've spoken to members of the Freedom Caucus who say the Ryan bill as it stands would raise premiums 15 to 20% over the next 2 years. That's what they claim.
That's balderdash. That is not true. CBO says it will reduce premiums by 10%. They can say that all they want. It's just not so.
Then why would they say that if it's not true?
I have no idea why they would say some of the things that they're saying. They're acting against a bill, the only bill that will repeal and replace Obamacare. At this point, after all the discussions, after all the changes have been made to it, how someone on the Republican side can continue to say, well, it's not good enough, you begin to ask yourself, were they ever going to be a yes on any bill that will repeal and replace Obamacare? And let's put them to a test. Let's do it right now.
And what I don't understand, Congressman, is surely you can go ahead and put the bones, the structure of this thing, pass it, and then if they have problems with some of the mandates, those can be eliminated in Phase 2 or Phase 3 down the line, but at least you get the bill passed.
Absolutely. We have a lot of good things that are already happening through the work that Dr. Price is doing at HHS. We passed 2 of the standalone bills that are part of Replace yesterday on the House floor. That process continues to move on. We need to keep the march toward victory here, and we don't need to be snatching defeat from the jaws of victory by shooting down the only bill that will repeal and replace Obamacare. You either vote with President Trump or you vote with Nancy Pelosi. It's really clear.
Well, if this doesn't happen, what kind of damage does that do to President Trump and his, his overall agenda that he would like to get set through? Because this is going to slow down tax reform and all the other policies that have really, frankly, pushed the markets higher and has led to a lot more optimism in this country.
Absolutely. It would be a setback. That's another reason why the people that keep talking about no need to get to yes. There's a lot more riding on this than just health care, although health care is big enough as it is.
All right, we'll have to leave it right there. You're obviously very fired up, Congressman Byrne. Let's see how the day plays out. But thank you for joining us. I appreciate it.
Good to be with you.